Welcome back. There's a very important conference going to take place in March, and all of us have to be there because it's very important to our healthcare system and its delivery. Talking to me this morning about the 5th Biennial Scientific Conference are Dr. Gina Teddy. She is a lecturer at GIMPA and founding coordinator for the Center for Health Systems and Policy Research. And then I've also got Dr. Genevieve Cecilia Aite. She is a senior lecturer with the School of Public Health, University of Ghana, and she's also a member of the Africa Health Economics and Policy Association Local Organizing Committee. Good morning, ladies.
Good morning.
So let's start off by talking about this conference and why it's so important to us when we talk about it in terms of universal health coverage.
Yeah, there you go.
Yeah. Well, the notion of universal health coverage came about in 1978 when there was the Conference on Public Health, which is popularly known as the Alma Mater, where it was declared that there has to be universal access to health for every citizen of every country. And it came about because there were inequalities or inequities in the distribution of health between countries and even within countries. So they saw health more or less as a fundamental human right. So that was when the whole issue of primary health care came about. And then there was the Health for All by the year 2000. I'm sure you remember that. So it's the same thing that we are trying to continue at this time. And then that is what has transformed into what we have as the universal health coverage now, which is looking more or less at the same provision of essential health services. But this time around, it has to be of high quality, it has to be efficient, and then it should come at a cost that will not make you worse off when you pay for health services. So basically, that's the whole conference.
Great. So obviously, this is not something that has just started. We've come a long way. We're still moving towards, the future. But when we talk about it in terms of Ghana and its attainment, how far have we come?
I think we've come very far in terms of its attainment, in that Ghana have taken certain strides in terms of the funding of healthcare through the National Health Insurance Scheme, where you contribute towards a scheme and then you don't pay at the point of healthcare. And that's the fundamental basis of universal health coverage, trying to provide primary healthcare. And then also making it affordable and making it possible so that people do not become worse off simply by using healthcare. But then the other milestone is also what we call the CHIPS, which is community-based health planning services program or strategy. And this is to increase or create inaccessibility, remove the barrier of inaccessibility. So they want to take healthcare right to the doorsteps of everybody and to make sure that people get healthcare right by their doorstep. Not necessarily going to the facility, but actually sometimes the health workers going to them. So these are key fundamental areas that they are increasing. And then also there has been a lot of policies to regulate funding, cost of healthcare, and also recently there was the removal of the VAT and other taxes on pharmaceuticals and medicines, and those are all key milestones towards universal health coverage. But with that said, there is still some gaps and problems.
Yeah. In addition, you can see that there are new developments in health in terms of constructions and new buildings, especially you can see from the Ridge Hospital, and I'm sure even within the regions, there are new hospitals, and you can talk about Volta region and all the other places where there are improvements in health, which is the other side of the UHC, which is quality healthcare and all that. And I can even say that even human resources are even improving. We can see that the number of nurses being trained, number of doctors being trained, and other allied health workers are also increasing. So gradually we are on our way. We are not there yet, but we are
There's still more room for improvement. But of course, when you talk about these things, then that will play on government's, investment in healthcare and what they're doing to make sure that universal health coverage becomes a reality. But it's always good to compare ourselves with other people who are also implementing it. So if you put us at par, how well are we doing in comparison to other continents and countries?
I think every country or every continent has its own problem. And so we comparing ourselves to our neighboring countries, starting with Rwanda. Rwanda is seen to be doing very, very well. But in terms of universal health coverage, people are doing well in different things because it focuses on different aspects. So it's focusing on the proportion of services that is being provided, the proportion of the population that is being reached, the proportion of quality that is being provided in a whole lot of things. So different countries are doing differently.
Right.
So in terms of comparing ourselves to Ethiopia, Ethiopia is at the moment one of the shining stars of achieving universal health coverage. And then Rwanda is also doing very well. But then when we compare ourselves to places like Kenya, Nigeria, and other places, we are doing also very well. So it's not actually all size fits all.
Right. Okay.
I think it depends on what your needs are and acknowledging truthfully what the challenges are and addressing them. And so I think this conference is going to create that platform of talking openly about some of the challenges.
And in fact, there was the Abuja Declaration in 2001, which says that all governments should allocate 15% of their budget to health. And then 10 years on, there was some kind of evaluation, and they found that it was only Tanzania that was able to achieve that 15%. But then, otherwise, 26 countries in Africa made some progress, including Ghana. And then there were some 11 others that went down, and then the rest of them were, they neither went up or down. So comparatively, we are on track. We are not there yet. And then also government, share of health expenditures has, in relation to GDP, has not really gone up, except for 2010, when it went to about 5.3%. But otherwise, it hovers around 3-point-something%. So we are still,
doing well, but there's more to do. But let's talk about the conference and the theme that you chose for the conference, and why that theme.
Okay, so I think the conference is about trying to speak about universal health coverage, which is quite broad. But we thought that to focus on it, we need to focus on primary health care, basically making sure that everybody have access to health care. So that is the purpose of the theme, to linking the two major global agendas together, because this is also part of the SDGs. And we want to, once we achieve some of these things, which is a long shot, once we achieve it, we are actually on our way there. So we selected this because we thought there was an opportunity for people to see the link, to actually talk honestly about some of the issues that are affecting us, and to bring all the stakeholders. There are certain stakeholders that we don't focus on, such as the NGOs, the health advocates, and other service providers, the private sector, for instance. And at the moment, majority, about 27% of health expenditure is out of pocket, which means that it's going to private sector, and sometimes even to the government sector. And so there is the need for us to have these conversations and bring different actors on board and say, okay, what are we doing well? How can we improve these things? And for that matter, that is the purpose of having to choose these two conferences and learning from others, because we are bringing people from all over the continent. So we are hoping this will be an opportunity.
So finally, touch on where it's happening, how we can access the place. Is it free or not?
It's happening at Kempinski Gold Coast Hotel, and from the 11th to the 14th of March 2019, and it's not free, unfortunately. There is a cost to it, and then also there are special discounts for students, and then also there's a day pass. So if you don't want to be there the whole time, you can register for a day, and then you can sit in the conference and then enjoy. And then there are opportunities for learning. The pre-conference will offer special sessions where you can learn, practical skills on how to do some of the analysis and all that. So it's good for students and people who want to have some kind of skills in analysis of health expenditures.
Very well. I'm sure you heard why you should be there on 11th to 14th at Kempinski Hotel, to make sure you learn a thing or two about primary health care and universal health coverage, because it affects all of us. When you have an idea and you can start something small in your own corner, certainly it will spread like a wildfire across the whole continent and across Ghana, most importantly. I have been speaking to Dr. Gina Teddy, lecturer at GIMPA and founding coordinator for the Center for Health Systems and Policy Research, and also Dr. Genevieve Cecilia Ayete, senior lecturer with the School of Public Health, University of Ghana, who's also a member of Africa Health Economics and Policy Association Local Organizing Committee. We have been talking about the 5th biennial scientific conference, which is happening this year. Make sure you partake in it because you learn a lot. But let's step out and run. What are we talking about? Nigeria's elections were postponed. What does that mean to us as Ghanaians? Does it have any impact?